Hello, I am Darlene Huisenga, a pediatric physical therapist from Advocate Children's Hospital in Oak Lawn, Illinois, the United States. I will briefly summarize our paper, Motor Development in Infants with Complex Congenital Heart Disease, a longitudinal study, which was published in the June 2022 issue of Developmental Medicine and Child Neurology. Complex congenital heart disease are structural defects in the heart and/or the vessels that cause complex alterations in blood flow and hemodynamics. Currently, many of these children survive. Children with CCHD, including single ventricle physiology, have an increased risk of brain injury due to impaired circulation, reduced blood oxygen capacity to the fetal and neonatal brain that affects brain growth. Two recent systematic reviews indicated that infants with CCHD, especially those with single ventricle diseases, are at increased risk for neurodevelopmental impairments in all domains. Severe motor impairment is more prevalent in younger children, whereas cognitive impairment, especially executive function skills and behavioral problems, are more prevalent at school age and in adolescence. Our study focuses on early development of infants with CCHD. Knowing how their development differs from typical infants offers opportunities for early intervention. To document the infant's development, we use the Infant Motor Profile, or the IMP. As many people are unfamiliar with this tool, first, a few words about its method. The IMP focuses on the quality of motor behavior by assessing 4 qualitative domains: variation, adaptability, symmetry, fluency, and 1 quantitative domain, which is performance or motor milestone. It results in 5 domain scores and a total score. Each assessment is video recorded and scored offline. The IMP has psychometric properties that are fine, including predictive validity for cerebral palsy, lower IQ scores, and less optimal behavior at school age. The present study aimed to see how infants with CCHD performed on the IMP. We addressed the following questions. Do infants with CCHD have worse IMP outcomes at 6, 12, and 18 months corrected age than reference infants in terms of raw scores and prevalence of scores below 15th centile? Do infants with single ventricle CCHD have worse IMP outcomes than children with 2 ventricle CCHD? And do infants with oxygen saturation below 90% at hospital discharge after their first surgery have worse IMP outcomes than children with oxygen saturation at or above 90%? The CCHD group involved consecutively eligible infants who underwent surgery at Advocate Children's Hospital between May 2015 to June 2019. Children were included when they had primary or palliative surgery within the first 30 days. Children with documented neurological or genetic diagnoses were excluded. The infants were assessed 3 times, at 6 months, 12 months, and 18 months corrected age. For reference, we had access to IMP data of a cohort of infants representative of the Dutch population. These infants were assessed once, so we had 100 infants at 6 months, another 100 infants at 12 months, and another 100 infants at 18 months. Scores below the 15th centile indicated at-risk development. So what did we find? Children with CCHD had consistently lower total IMP scores than the reference children. As a result, children with CCHD had at 6 to 14 times greater risk of total IMP scores below the 15th centile. The domains of variation, adaptability, and performance especially contributed to the lower score. Here you see the difference in IMP development between infants with 1 ventricle and 2 ventricle physiology analyzed with a linear mixed effects models. Children with single ventricles scored on average 3% lower than children with two ventricles. The 3% lower score meant, for instance, that at 18 months, 75% of children with a single ventricle scored below the 15th centile, whereas 45% of children with two ventricles did. The variation score of children with one ventricle was not statistically different than that of children with two ventricles. However, children with a single ventricle showed a steeper slope than children with two ventricles. The performance domain score of children with one ventricle was consistently lower than that of children with two ventricles and showed a different developmental trajectory. Here, a similar slide. Here we see the difference in the trajectories of total scores of the infants with low or adequate SpO2 at discharge. We see the children with SpO2 less than 90% at hospital discharge scored 2.5% lower than children with higher SpO2s. Lower performance scores especially brought about the difference. However, we also found that SpO2 did not affect the scores of variation and performance. So the study is the first to assess the development trajectories and the quality of motor behavior in infants with CCHD throughout infancy. It showed that children with CCHD had significantly lower IMP scores than the reference group, with much greater risk of total IMP scores below the 15th centile. The domains of variation, adaptability, and performance accounted especially for this difference. This is important information because these domains are associated with long-term outcomes, including cerebral palsy, lower IQ scores, and behavioral problems. Infants with single ventricle physiology are especially at risk. Infants with low IMP scores deserve early intervention. Thank you for your attention.